A teaching hospital or university hospital is a hospital or medical center that provides medical education and training to future and current health professionals. Teaching hospitals are almost always affiliated with one or more universities and are often co-located with medical schools. Teaching hospitals are defined as medical institutions that provide care while also serving as educational facilities for medical students and residents, organizing services to facilitate instruction and emphasizing specialty care procedures. They often face challenges in balancing their educational roles with the need to provide continuity of care to patients, particularly in underserved urban areas. Teaching hospitals use a residency program to educate qualified physicians, podiatrists, dentists, and pharmacists who are receiving training after attaining the degree of MD, DO, DPM, DDS, DMD, PharmD, BDS, BDent, MBBS, MBCHB, or BMed. Those that attend a teaching hospital or clinic practice medicine under the direct or indirect supervision of a senior medical clinician registered in that specialty, such as an attending physician or consultant. The purpose of these residency programs is to create an environment where new doctors can learn to practice medicine. The first teaching hospital where students were authorized to methodically practice on patients under the supervision of physicians was reportedly the Academy of Gundisapur in the Persian Empire during the Sassanid era. Some of the earliest teaching hospitals were the Islamic Bimaristans, which included the Al-Adudi Hospital founded in Baghdad in 981 and the Al-Fustat Hospital in Cairo founded in 872. Definitions. The following definitions are commonly used in connection with teaching hospitals. Medical student: a person enrolled in a medical degree program at a medical school. In the graduate medical education model used in the United States, medical students must first complete an undergraduate degree from a university or college before being accepted to a medical school. In the undergraduate model traditionally used in countries such as the United Kingdom or Australia, medicine is an undergraduate university degree which students directly enter from high school. In more recent years, the graduate model has increasingly been adopted in the UK and Australia as well, without entirely displacing the traditional undergraduate model. Both graduate entry and undergraduate entry programs coexist. Historically, the undergraduate model used to exist in the US as well, but had been abandoned by the mid-19th century. Physician assistant medical professionals who have completed training at the master's level. They are trained to practice medicine alongside physicians on a population level, allowing them to work in a wide range of specialties. This profession is not traditionally found in most countries outside North America, but in recent years there have been attempts to establish it in some of them, with mixed success. In turn, a person that has a doctorate of medicine from a graduate medical school, or a Bachelor of Medicine/Bachelor of Surgery, in the British undergraduate model, that only practices with guidance and supervision of a physician/consultant. Residency or postgraduate program in the US and Canada, individuals that have completed their first year of a medical internship. Residencies may last anywhere from 2 to 7 years, depending on the specialty. In most Commonwealth countries, the role of specialist registrar is roughly equivalent. Specialist registrar in the British system, a doctor who is receiving advanced training in a medical specialty in a hospital setting. After 4 to 6 years as a specialist registrar, the doctor may then undertake a post-training fellowship, before becoming a consultant. Attending physician in the US and Canada, an attending physician, also known as an attending, rendering doc, or staff physician, is a physician, MD or DO, who has completed residency and practices medicine in a clinic or hospital, in the specialty learned during residency. An attending physician typically supervises fellows, residents, medical students, and other practitioners. Attending physicians may also maintain professorships at an affiliated medical school. Consultant: the equivalent concept to attending physician in most Commonwealth countries, except for Canada. Fellowship: medicine, a period of medical training in the United States and Canada, that a physician, dentist, or veterinarian may undertake after completing a specialty training program, residency. During this time, usually over a year, the physician is known as a fellow. Fellows are capable of acting as an attending physician or a consultant physician in the specialist field in which they were trained. Grand rounds, a methodology of medical education and inpatient care, consisting of presenting the medical problems and treatment of a particular patient to an audience consisting of doctors, pharmacists, residents, and medical students. It was first conceived by clinicians as a way for junior colleagues to round on patients. Teaching clinic. A teaching clinic is an outpatient clinic that provides health care for ambulatory patients, as opposed to inpatients, treated in a hospital. Teaching clinics traditionally are operated by educational facilities and provide free or low-cost services to patients. Nurse education. Some teaching hospitals partner with nursing education institutions to provide in-hospital, practical education for nurses, both graduate and undergraduate. Research. Many teaching hospitals and medical centers are known for the medical research that is performed in their hospitals. Close association with medical colleges and universities enhances the research programs at teaching hospitals. Some of the more notable teaching hospitals include Cedars-Sinai Medical Center in Los Angeles, California, U.S. UPMC Presbyterian in Pittsburgh, Pennsylvania, U.S. Charite in Berlin, Germany. Cleveland Clinic in Cleveland, Ohio, U.S. Dhaka Medical College Hospital in Dhaka, Bangladesh. Johns Hopkins Hospital in Baltimore, Maryland, U.S. Massachusetts General Hospital in Boston, Massachusetts, U.S. Mayo Clinic in Rochester, Minnesota, U.S. North Shore University Health System in Northbrook, Illinois, U.S. Ronald Reagan UCLA Medical Center in Los Angeles, California, U.S. Sheba Medical Center in Ramat Gan, Israel. Singapore General Hospital in Bukit Merah, Singapore. Toronto General Hospital in Toronto, Ontario, Canada. University of Alberta Hospital in Edmonton, Alberta, Canada. University Hospital of Zurich in Zurich, Switzerland. What is a teaching hospital? A teaching hospital is linked to a medical school, and Stanford Children's Health clinics are linked to University Medical Center. A teaching hospital is also called an academic medical center. Is where doctors and other healthcare providers train to become general doctors and specialists. Is where your healthcare team may include doctors and other healthcare providers who are at different levels of training to be specialists in the many areas of medicine. Is a place where there is research that is trying to improve medicine and provide advancements. Includes a hospital and clinics for all the different specialists. What benefit will be going to a teaching hospital have for me or my child? At a teaching hospital, you or your child can get care that other hospitals and clinics cannot give, such as specialty care or for complicated health conditions which requires many people to work together. What benefit does a teaching hospital offer me or my child? Clinics at a teaching hospital have the specialists to care for specific healthcare needs. Teaching hospitals may be the only place that you or your child can get the special care you need. Many other clinics do not have specialists, especially for children. At a teaching hospital you can have many specialists who work together to help give you all the care you need and cannot get elsewhere. At a teaching hospital new ideas are made and shared. You or your child may have the opportunity to participate in clinical research studies. Research at teaching hospitals helps to advance medicine for all people. Having the opportunity to be involved with research means you may have medical care available that is not available outside of the research project. You or your child are helping other families and children of the future. You or your child are helping to train the future leaders in medicine. Why are teaching hospitals important? A teaching hospital trains doctors and specialists and is also a place where research is done. Teaching hospitals are important because this is where healthcare providers train to become doctors and specialists in medicine. The healthcare providers and researchers are involved with or learning about research being done at Stanford Children's Health and other teaching hospitals. Healthcare providers learn about advancements in medicine through research and teaching. Through research, a teaching hospital is part of making healthcare better to improve people's lives. The entire healthcare team is exposed to new ideas and technology that may help improve your health. Healthcare teams work together to provide the most advanced healthcare for you or your child. Teaching hospitals are responsible for training the next generation of healthcare providers and are the front runners in medical research and technology while delivering the highest possible level of effective and safe patient care. A teaching hospital stays up to date with the latest medical developments and most advanced healthcare technology. For physicians, graduate medical education, or residency, is the next step in training for physicians who have successfully completed medical school. Board-certified attending physicians provide, supervise and train the medical school graduates at teaching hospitals. Upon your arrival and under the guidance of your physician, your resident will review the history of your current illness and past medical history. A physical examination will be performed to substantiate previous findings and evaluate changes. Some of the questions and procedures may seem repetitive, particularly given the anxiety that comes from being hospitalized. Be assured that the resident is acting in your best interest as an essential member of your healthcare team. Your resident will be in close touch with your physician to provide updates on your condition. Frequently, this new information on your progress will speed your recovery. While the resident may not be able to answer all of your questions immediately, he or she will respond as soon as possible. Please remember that laboratory test results and consultations must be evaluated by your attending physician, who has the ultimate responsibility for your care. Some of the healthcare professionals you may meet during a stay at a teaching hospital. Attending physician, a board-certified doctor who has been educated, trained, and licensed to practice the art and science of medicine, and who is responsible for the care of patients. Attending physicians supervise all patient care performed by residents. Resident physician, a physician serving in the hospital as part of his/her graduate medical education. Resident physicians receive supervised clinical training under the direction of an attending physician. Chief resident physician, a physician in the final year of a residency program or in the year after the residency has finished. Chief resident physicians play an important role in guiding new residents. Hospitalists, licensed attending physicians who spend most of their time caring for inpatients in the hospital. Hospitalists take over the care of outpatient physicians' patients and return them to the care of their primary care providers upon discharge. Nurse practitioner, a registered nurse with at least a master's degree in nursing and advanced education in the primary care of a particular group of patients. Registered nurse, RN, a nurse who has graduated from an accredited nursing program and has been registered and licensed to practice by the state. Licensed practical nurse, LPN, a nurse who has graduated from a school of practical, vocational, nursing and is licensed to practice by the state. Physician's assistant, a healthcare professional who is certified by the National Commission on Certification of PAS in conjunction with the National Board of Medical Examiners. Physician's assistants are licensed to practice certain aspects of medicine care, history taking, physical examination and diagnosis, the treatment of common medical problems, under the supervision of a licensed physician. Healthcare team, the medical center has a variety of allied healthcare professionals working in a variety of fields. These specialists are trained in areas such as drawing blood, using diagnostic scans, performing laboratory testing and regulating dietary needs. Students in healthcare fields, the medical center provides a setting for the education of a variety of students who are being trained in a healthcare field, including medical students and those in nursing, pharmacy, and physician assistant programs. These students, under the supervision of the attending physicians, continue their medical education by observing clinical care.